Welcome to another virtual listening session held by members of the Board of County Commissioners. I'm Dylan Blaylock with Clackamas County's Public and Government Affairs Department, and I'll be coordinating the public comments for today's meeting. Today's topic is mental health and wellness during the time of coronavirus. Today's listening session will go until 4 o'clock or until we run out of comments and questions, whichever comes first. The session will be archived to YouTube. This is an opportunity for commissioners and other county officials to hear from the public about your experiences and opinions, your questions and concerns. We have several guests with us today who are mental health experts from Clackamas County. I'll introduce them all in a moment, but first we'll hear opening comments from our commissioners in attendance, Commissioner Martha Schrader and Commissioner Sonia Fisher. Vice Chair Schrader, would you like to start?
Well, I'll be very brief. I'm so glad we're doing this today because I do know that in the midst of this, it can be an extremely isolating experience. And as someone who has dealt with mental illness in my own family, I know how difficult it can be, even in times when things are normal. So this extra added layer of isolation, of uncertainty, of feeling as if there's no way to turn is being exacerbated. And it's my hope that our constituents, I know with my colleague, Commissioner Fisher, know that they have people to count on here in Clackamas County, that we are dedicated to helping people stay well, not only physically, but also behaviorally, also when you're experiencing depression. I do know that isolation can exacerbate all of this. And my hope today is to learn from our citizens about what their needs are, so our professionals who are with us today can help us address those needs to the best of our ability as county officials. So with that, I'm going to hand it over to my dear friend and colleague, Commissioner Sonia Fisher.
Thank you, Commissioner Schrader, and thank you everyone for being here today. Today we have 3 different short presentations to begin our event. First, we will hear about mental health awareness. This will relay why it's okay to be having a hard time during this pandemic and point out what resources are available. Next, we will hear how to ask the question. If you are worried about a loved one or someone you work with or a neighbor that may need help, this presentation relays what you can do to intervene. And also, we will hear about resources and supports for at-risk populations. This will include what our Emergency Operations Center is doing to support our community, including our most at-risk populations. These presentations should take us about maybe 20, 30 minutes past this hour, at which point we'll take your comments and questions. Again, please email them to clacconews@clackamas.us. And as you will hear throughout this presentation, it's really important to know that we have a 24-hour, 7 days a week crisis and support line. And that number is 503-655-8585. And that number can also be found at www.clackamas.us/behavioral health. And with that, I'll pass it back to Dylan.
Thank you, Commissioner Fisher. I'm going to share my screen just real quickly to show people where that is located. If you go, and you can see it now, it's on our coronavirus page. If you go to clackamas.us/coronavirus, and then right here, there's a button for mental health support. You can click that, and that is the number right there. And you can see it's a very good page with a bunch of different resources that we have. So thank you each for that. Okay, so let me see. Today's format is a little bit different. Before I go to our other guests, we're only going to be taking emails today for questions and comments. That's because we want to make sure that everyone who needs who can get the help that they need if you want to talk to someone. Obviously, these folks are not available right now, but again, you can call the crisis line if you feel like you are in crisis or you need help. Again, that number is 503-655-8585. So, as the commissioners referenced, we have 3 presentations to hear from our guests. I'll introduce our guests first. Elise Thompson is the System Coordination Manager for the Behavioral Health Division at Clackamas County. That division is within our Health, Housing, and Human Services Department. Gallie Murray is Suicide Prevention Coordinator for Clackamas County Health, Housing, and Human Services. And Dr. Jeffrey Anderson is the Crisis Clinic Supervisor and the Coordinator of the Behavioral Health Branch at our Emergency Operations Center. Thank you, all 3 of you, for joining us today. I appreciate your time. We will start with Elise. Elise? Oh, you're muted. There we go. Okay, great.
Thank you, Dylan. And thank you very much to the commissioners for making it possible for us to join you and hear the questions and concerns of our community on what is obviously to us a very important topic. At this point, I'm guessing that most of us are familiar with the physical health recommendations and guidance about COVID-19, sheltering in place, social distancing, wearing a mask, hand washing. However, we may not be as familiar with how this pandemic and the recommendations that I just mentioned are affecting our mental and emotional health. We're all here to spend a little time talking about that today. We're now 6 weeks into this new normal, and I don't know about any of you, but I'm still struggling to figure out what it is exactly that I am supposed to be getting used to. For each of us, the impact of this unprecedented change in our daily lives is different. Many of you who are listening this afternoon may be experiencing a variety of stressors, including financial worries, working from home, and I'm going to share, I prefer a description that a colleague of mine gave us about working from home, which is not working from home, but you're at your home during a crisis trying to work, which just has a different feel to it to me. Also, challenges in supporting your kids, either homeschooling or general childcare. Some of you are caring for family members at a distance who also might be physically or emotionally vulnerable. And lastly, the loss of many of the activities and relationships in your life that lift you up and make you feel connected and supported, like visiting with friends or family, attending church or other spiritual practices, recovery meetings, therapy, coffee or a meal out with a friend, community gardening, shared childcare with neighbors and friends. And all of those stressors can affect us in as many different ways as there are people listening right now. Those changes can include changes in sleeping or eating patterns, feeling down or more anxious or depressed, an overall loss of energy and interest, and social isolation and loneliness. And we're talking about on top of just social distancing, just having difficulty motivating yourself to reach out and connect at all. And finally, thoughts of suicide. And I'm going to let Gallie speak in more depth about suicidal thoughts and how we can acknowledge and respond to those thoughts in ourselves, our loved ones, and those whose lives we touch. I'm going to take my last minute or two to focus on loneliness and the power of connection. In these strange times, connection is more important than ever, as we're all trying to figure out how to still feel part of our community, however you each define community. Sheltering in place and physical distancing, these are making all of us vulnerable to loneliness in a way that many of us have not experienced before. And we have members of our community who are particularly vulnerable to loneliness, including older adults, LGBTQ folks, parts of our rural communities, veterans, and those who are houseless. For yourselves and those you love and care about, if there is one message I'd like to leave you with, it is, you are not alone. We are all just doing our best, one day at a time, sometimes 1 hour at a time, to figure out new ways to feel connected with each other. And there is no one answer, no right answer. Some of you may use social media. Take a walk through your neighborhood and shout a hello at folks across the street. Call or FaceTime with friends and family. And if you just don't know where to start, we are here for you 24/7 at our crisis and support line, and you will hear this number frequently, 503-655-8585. Call anytime, as often as you like, for any reason, including just wanting to hear a voice on the other end of the line. Remember, you matter.
Thank you very much for that, Elise. And next we will go to Gally Murray.
Thanks so much, Dylan and commissioners, for creating space to talk about mental health. And thanks to the other folks who've joined me today. And thanks to all of you who are listening in and watching us today. Your participation, your viewing of this is essential to getting these messages out. So thanks for being here. The county has been doing suicide prevention for many, many years. And in the context of COVID-19, I'm here today to ask for your help and to join us in this work, as it's more important than ever. At the core of the work of suicide prevention is connection. Elise mentioned this already, and I'm going to talk a little bit more about connection. Research says that the people who feel connected, either to each other, to a purpose, to their faith, people who feel connected are less likely to die from suicide. This connection actually serves as a protective factor against suicide. And to be able to promote connection, you actually don't need to be an expert. You just need to reach out, and you need to be a good listener. So if you're thinking that you're not a mental health professional, that maybe you don't have any training in suicide prevention, that the work you do personally or professionally is so far removed from the world of mental health and behavioral health, I'm here to tell you that for reaching out to others and promoting connection, none of that matters. So if you have a feeling that someone you know or care about isn't behaving as they normally would, or if they seem a little bit out of sorts, or they just don't seem like themselves, trust your gut instinct and act on it. And I'm going to give you 4 easy tips on how to start a conversation if you're concerned about someone, and how to actually ask the question. So number 1, you ask someone, "Are you okay?" It's a simple question, and it can mean the difference in the life of someone who's struggling, and it can actually save a life. So number 1, ask, "Are you okay?" Number 2, listen. Don't give advice. Don't try and fix it. Don't judge. Just listen. And sometimes it means sitting in uncomfortable silence and just being patient and just listening. Number 3, encourage action. So you might ask the person who's struggling, what's something you can do for yourself right now? Maybe something that's relaxing, or something like, how would you like me to support you right now during this time when you're struggling so much? Also, this is another time that, to remind you all that some conversations like this are absolutely too big for you and others to take on alone. And that's where the Clackamas County Crisis and Support Line comes into play. Again, you've heard it mentioned a couple times, and by the end of today's broadcast, I'm hoping that you'll be able to memorize this number. But the Crisis and Support Line is always available to help you make a plan or to help you walk through next steps. And that number is 503-655-8585. The 4th simple step of starting a conversation and asking the question is to check in. So put a reminder in your calendar to call the person who you care about or you're concerned about in a couple weeks. If they're really struggling, follow up with them a little bit even sooner. So you might say something like, "Hey, I've been thinking about you since we chatted last, and I'm just curious to know how you're doing. Can I help you?" So those are 4 simple steps. And by starting a conversation and commenting on the changes that you've noticed, you could help that family member, that friend, that colleague open up. And if they say they're not okay and additional support is needed, guess what? Our Crisis and Support Line is available for you 24/7. No matter issues big or small, please utilize them. They are here to help you and to get through issues big or small. And last but not least, if the person you're talking to is actually okay, that person's going to know that you're someone who cares enough to ask and who cares enough to notice that they maybe seemed a little bit off. Now is the time, more than ever, for Clackamas County to come together more so as a community to support one another in intentional ways and to be on the lookout for those around us who may need additional support during this already very challenging time. Ways that you can get involved in joining us in this work, and we need your help. Ways that you can be intentional are put the Clackamas County Crisis and Support Line in your cell phone. My guess is that all of you have at least one cell phone near you within arm's reach right now. Grab it, put the Crisis and Support Line in your phone. Just like 911 is in there, we want you to know that the Crisis and Support Line is there, that professional support is literally at your fingertips if you ever need it. The second way that you can be intentional in joining us in this work is to use the 4 tips that I just talked about, to start a conversation, to reach out, to start a conversation. And yes, sometimes those conversations are awkward, but you know what? Those conversations can make a huge difference. So reminder about those conversations, 4 tips. Ask, are you okay? Listen is the second thing. The third thing is encourage action. And the fourth and last thing is check in on that person, see how they're doing after you've offered them some support. The last way you can get involved is to get trained to help. So get trained to help to learn signs and symptoms of someone who might be struggling by taking a free 2-hour virtual question, persuade, and refer suicide prevention class. It's evidence-based by going to the website that Dylan has up. It's gettrainedtohelp.com. Gettrainedtohelp.com. You'll find lots of information about how to register and the classes available. And there's availability in the classes as soon as tomorrow night, the 30th at 6 p.m. and on May 4th at 9 a.m. and many, many more. And again, the website is gettrainedtohelp.com. And once we are no longer sheltering in place and physical distancing has lifted, all of the trainings on that website will go back to being in person and face-to-face. Thanks so much for joining me today and joining all of us today and being a part of the conversation and being a part of the work of mental health and suicide prevention. And at this point, I'm going to turn it back over to Dylan.
Thank you very much for that, Callie, and thanks for pointing out those resources. Next up is Dr. Jeffrey Anderson. Jeffrey.
Thank you, Dylan. Thank you all for tuning in, and thank you, commissioners, for inviting us today. So our public health effort thus far has focused completely correctly on saving lives and mitigating the short-term consequences of COVID-19. So unlike the aftermath of other types of disasters, this pandemic is expected to have far-reaching and pretty much universal emotional, behavioral, and psychological impacts. Every individual in our community is affected by this disaster. And unfortunately, this isn't a brief thing. It's not a seasonal thing. Personal, financial hardships brought about by loss of employment, restrictions on our personal community support networks will continue to cause significant challenges to many of us over the coming year. We expect long-term isolation and even living in close quarters with loved ones to have lasting consequences. So beyond that, individuals already struggling with mental health or substance use conditions are at greater risk for experiencing increased symptoms or a relapse over time. And then on top of that, workforce challenges within our own behavioral health system of care, which were already somewhat barriers to getting people into mental health and substance use treatment, will now be compounded as the current behavioral health workforce struggles to stay healthy, both psychologically and physically, all the while the number of individuals we expect to be seeking services is going to surge. So having said all that, I want to introduce you to what the Emergency Operations Center has been up to in order to counter some of these impacts of COVID-19. So the EOC invited behavioral health to create a behavioral health branch just a couple weeks ago. And we have, over the course of these 2 weeks, developed some services that we are calling Go Teams. Our first Go Team, which started doing work this past Monday, is made up of 6 county staff with completely various backgrounds. The team is mobile. They're able to meet individuals where they're at, and they're trained in psychological first aid. And I'll talk about psychological first aid in a minute. The primary goal here is to minimize the harmful emotional impacts of stress and trauma associated with the pandemic, while we help people tap into their own resilience. Our secondary objectives are to provide accurate information about COVID-19 and to provide guidance on how to cope with isolation, loneliness, mood issues, anxiety, suicidality, substance use, and other stresses during this pandemic. So let me define psychological first aid a little bit, and I'm going to call it by its abbreviation, which is PFA. So PFA is an evidence-informed practice where we identify and respond to people who need help because they're feeling distress resulting from an unanticipated situation, a disaster, a tragedy. It's been around for a number of years, and there are a lot of people who use this specifically with regard to tragedies. In this case, we're using it in response to COVID-19 and everything resulting from that. PFA is also designed as a way to triage or assess the need for continued mental health care or other supports. PFA is not a process of diagnosis. It isn't a therapy. It's not case management. It's not crisis mental health. It's none of those things. In fact, PFA providers can be anyone as long as they're trained in PFA. To give you a better sense of what I'm talking about, someone practicing PFA will first try to make a connection with an individual. They'll approach them and ask, are you able to talk with me today? We'll connect by really listening to the person, showing empathy and showing care. We might also attempt to meet the person's basic needs, like giving them water or a snack. Throughout this interaction, they'll encourage good coping by giving specific examples. So we might be drawing some examples out of the individual, finding out what's worked in the past, or we might be giving them some new coping skills based on the story that they've told us. And then by the end of this talk, we're also hoping to have helped the individual connect to other resources that they might need based on what they're telling us. So these could be treatment, these could be figuring out how to get social support right now, or even connecting to one of those support lines. So this whole interaction is going to be tailored to what the person needs. So some people, they don't need to talk about their feelings. They aren't going to want to tell us a story. Instead, they might want a phone number or a resource list. Others want to tell their story, and in so doing, will feel supported. So these interactions are meant to promote people's natural ability to be resilient, to reduce their own anxiety and distress, and also to understand that these feelings, especially right now, are completely normal. Feeling isolated, feeling alone. These are things that a lot of people are feeling. And this isn't pathology per se at all. This is a reaction, a normal reaction to an abnormal situation. Sometimes the most powerful thing is to have someone sit and listen and just make us feel heard. And that's what our goal is, in addition to providing connection to the right resources. So again, overall aim here is to decrease the emotional effects of stress and trauma, which should then help people going forward in that they'll be less likely to develop more serious symptoms. If people are interested in support from the GO teams, please reach out. We are seriously just here to listen and support you. Thank you.
Thank you very much for that, Dr. Anderson, and thanks again to all of our guests. I will remind everyone who is an attendee, so that's about 150 people. Thank you for joining us today. Our format today is a little bit different than how we have done it. We're only taking emails today for questions and comments. That's because we want to make sure that you all get the help that you need if you want to talk to someone immediately. Since obviously our staff here is not available right now, you can call the crisis line at 503-655-8585. But we are taking questions and comments via email, and I'm going to go ahead and show the email address just to make it super clear. You can go ahead and email us at clacconews@clackamas.us, like Clackamas County, clacconews@clackamas.us. And with that, I'm going to go ahead and take some of the emails that we have gotten thus far. So the first is from Erica. I live with and take care of my mother. She is in her 70s and is medically fragile. I dare not leave the house other than getting essentials. The two of us live in Happy Valley. My sisters aren't able to come see her, and we're a tight family. I am my mother's caregiver. It is an honor and a responsibility I respect and am humbled by daily. Although it's a lonely job being a caregiver to a family member, I took care of my husband as cancer ate him. That was an incredibly difficult road, but I was surrounded by a group of wonderful people who made it their business to be my caregivers. This isolation is brutal. I'm uninsured, so there are no virtual visits with a mental health provider. I cannot afford a monthly subscription to text or virtually visit with a mental health provider. I am hesitant to start a group for fear of trolls and really feel like there needs to be a safe place for us. Whether or not there is an answer, I feel compelled to add this fringe group to the dialogue. Thank you for being good ambassadors for this little community. We're talking and you're listening. Who would like to respond to that first one?
I can start and then, oh, go ahead. Go ahead, Jeffrey.
I was going to say, thank you for sharing that. And I think that the Go teams that I just described might be one potential source of support. And the way that you get support from those teams, I actually didn't mention this, everyone else did. It's the same number. It's the 503-655-8585, the crisis and support line. So they're able to work with you on the phone. They could work virtually. They could come in person. Again, this isn't therapy, but they can at least help sort out some of what's needed. I would also say that it would be a good idea for you to call the crisis line, just asking them for support. We're doing at the crisis line right now, our urgent walk-in clinic isn't open to the public right now, but they are doing phone assessment and they are able to talk to you and do a little bit of therapy on the phone. So I would recommend that to you.
And I'm going to add, Dylan, just a couple of other resources. First, Erica, thank you so much for reaching out and for sharing with us what's happening in your life. And thank you for being a caregiver. It is a phenomenally rewarding and challenging role to play. So bless you for that. I'm going to give you a couple of other resources. Clackamas County has a wonderful program called the Family Caregiver Support Program. And basically they provide support to family caregivers within the challenges of their caregiving role. So very much what it is that you're lifting up in your family now. And their number is 503-650-5724. Again, 503-650-5724. Thank you so much, Dylan. And I'm going to give you one more reference, Erica, for our Aging and Disability Resource Connection, the ADRC. The ADRC is really the be-all and end-all resource and support for all things having to do with folks who are either have a physical disability and or are aging in our community. Our ADRC folks are amazing whizzes at all kinds of resources and supports that are available for folks who are either living with or caring for and supporting folks who are aging or have physical disabilities in our community. Again, that's the ADRC. Their number is 503-650-5622. Again, 650-5622. And there's just a couple of other places to start. And when you call the crisis line, they will also be able to provide you with other referrals. And I'm so glad you reached out, and please do make sure, Erica, that you are getting support for yourself. What you are lifting up is amazing. And I know your mother appreciates it, but you need to take care of yourself as well. So thank you for reaching out.
All right, thanks everybody for answering that with some excellent resources. The next question that I'm going to relay is from a familiar name, I think to everybody at the county, Martha. I don't know if it's Martha Spears or Martha Spires, but it's one of those. I never learned the pronunciation. From Clackamas Volunteers in Medicine. I am the executive director of a volunteer-driven free clinic serving adults in Clackamas County. We don't have much of a mental health component to speak of, but we're working on it. Is there any written guidance for primary care physicians providing telehealth services to patients during this time? Physicians who don't have the benefit of behavioral health consultants to take over. Questions to ask, referral sources to access for patients who are struggling, and culturally specific supports for undocumented patients who may be reluctant to access help. Thank you in advance.
So Dylan, I can speak to that partially. Behavioral health put together a couple of scripts a while back that are helpful for non-behavioral health providers in asking folks kind of where they're at in terms of mental health and then trying to help them get those resources that they need. So, you know, if people want to maybe email that email address of yours, Dylan, we can share that wide. We've shared it with a lot of our partners. We've shared it with all of the, I think the Health, Housing, and Human Services department. And I think it's helpful. We got one just for, we have one for older adults and one for anybody. And they're specific to, the one for anybody is really has some additional information about suicide prevention. So we're happy to share that with anyone. So that's one thing. I can tell you that our primary care clinics are experiencing challenges in screening folks via telehealth for mental health. That's harder to do when you're not in the office. But I know that they are working on a plan for that.
I would just add one more thing in response to Martha's question, which is I know that the OHA website has a really significant section about telehealth and best practices in telehealth, kind of tips in telehealth, both for physical health and behavioral health. So that might be something that's helpful to check on as well. And they're updating it fairly regularly.
Okay, great. Thank you both for that. The next one is to commissioners that we've gotten online. What is the commission, the Board of County Commissioners, doing to support these programs or promote mental health in general? How are you supporting the groups that are out in the county?
Oh, Dylan, I'll go ahead and start with that. I think that the most important thing that the commission has done is we've set the priorities and the values of the county through Performance Clackamas. And one of our main priorities is to ensure safe and healthy communities, which is a benchmark for which we encourage, inspire, and promote our staff to do the amazing work that we do. So I think from my perspective, and I'm sure Martha can add on to this, it's really promoting a culture of caring throughout Clackamas County, and that is carried through by our incredibly competent and supportive staff. And with that, I'll hand it over to Commissioner Schrader.
Well, thank you for that, Commissioner Fisher. I entirely agree with what you just said. And I think that as we move into what is going to be, I suspect, a challenging budget cycle, that you will see us, I believe, with our colleagues as a commission, continuing to prioritize those programs that help the most vulnerable, particularly in the mental health arena. And that will be guided by Performance Clackamas, because what it does is tie essentially the program to specific outcomes. So we will measure, evidence-based processes that work to help to maintain the mental health of the community that we serve. And that's going to be very important for us to continue to do the prioritization process that we need to be doing to make sure we have those delivery systems intact. I will also add that one of the reasons this is so essential is that really these kinds of programs seem to rest largely under a county umbrella. So we are not just serving unincorporated areas, we are also serving all 16 cities with these kinds of programs. Oftentimes, given the size of our cities, this notion of behavioral health is not necessarily under their umbrella. So it falls to us as a county partner to make sure that those services are provided. And I think that with the staff that we have that's been doing fantastic work, and with the colleagues that I work with on the commission, including you, I think we've been doing an excellent job, even under these circumstances that we're dealing with now.
Thank you very much to both of you. Oh, thank you very much to both of you for that. And you can always find out more about the Performance Clackamas strategic priorities that were referenced there at clackamas.us/performance. The next question comment we have, it comes from Anne. Thank you so much for opening up this conversation. Working at an adult center in Clackamas County during this crisis, my staff and I have encountered widespread depression, anxiety, and persons expressing suicidal ideas. Since the beginning, we have pushed out resources, friendship lines, crisis help, but one thing I would love to see is access to counseling. Older adults can and do respond well to CBT and other modes. Is there any way we could set up this type of service via the telephone? And I'm sorry, I don't know what CBT is. I'm sure one of our experts does.
I can start that one. Thank you so much, Anne, for reaching out, and thank you for all the support you provide through our senior centers. There's a couple places where I would recommend you start. One being referring people to the crisis and support line, and I'll tell you specifically why I'm suggesting that now. We are working very, very hard regionally to really keep track, actually really close daily track of access to services in all of our providers in our community. So every provider has kind of different challenges and different capacities to provide telehealth. Our amazing crisis line staff have that updated information every single day. So a person could call the crisis and support line and say, I am looking for somebody who can provide individual therapy for me. It would be helpful for them to say whether or not they have Medicare or Medicaid, because different facilities or different organizations have different capacities. So I would start with the crisis line. Obviously, if you've got folks who have private insurance, we always encourage folks to look at your insurance card and call the customer service number on your card. If you have Medicare, I'd probably just start with calling our crisis line, because the helpline on the Medicare, the general Medicare, probably has a long wait. And our crisis line folks will be able to tell you what kind of capacity we have in our local provider network. I don't know, Jeffrey, if you had something else to.
Yeah, I was going to say that, but also the website that Dylan showed you earlier, the mental health part of the Clackamas County website, I think at the very bottom of that, it lists a bunch of providers. And I think those are, some of them are behavioral health or mental health providers who can help folks with depression. If you keep going, yeah, like Cascadia Behavioral Health Care is still open and they're providing telehealth services. All of those folks, as far as I know, are still doing some services. So I would also just recommend looking at this page, and we will update that website, our part of the website, if anything changes.
Okay, great. Thank you both very much for that. We've gotten some questions that have come in. Let me get one in front of me. What about if someone who needs help due to depression or isolation does not really like people, especially someone they do not know? What would you advise? Oh, everybody's.
That's a tough one. Let me just try. So that's interesting. I've heard people sort of talk about this experience of being an introvert and actually usually really enjoying being alone. But now that you don't really have a choice, it feels like a different thing. And for some people, contact with other people in person isn't restorative necessarily. So, I mean, I think folks do need to sort of look at what sort of works for them in terms of self-care. What are the things that you can do for yourself, whether it's, you know, getting exercise, making sure that you are eating well. And I mean, it may be that other people aren't your thing. And so our services from the Go team probably wouldn't be that useful. But yeah, beyond that, I don't know that I have advice. If you're not looking to connect, I think finding activities that are going to make you feel better and sort of alleviate some of your stress.
I'm happy to take a go at this as well, Lisa, and then you can add. So a couple things about this person who wrote in. So thank you for the comment. I would encourage you, along what Jeffrey said, is to think about doing something new every day. I know that's something that I've been trying to do, of think about the things that are novel, actually are easier things for us to find a little bit of joy in sometimes. So encouraging yourself to do something new every day, even if it's like watching a different TV station, or maybe going for a different route on your walk, or doing something different just to kind of have something novel, is something that can be really helpful. The other thing that I was going to suggest is, if you call the Clackamas County Crisis and Support Line, or if you go on the website that Dylan is pulling up, there are this amazing group of folks out there called peer support specialists. And peer support specialists are individuals who have gone through an incredible amount of training and also have lived experience with life, whether it's mental health issues or substance use issues or what have you. And peer support specialists are not mental health professionals, and they are able and are really good at connecting with individuals in a very natural, organic way. And people like us as mental health professionals can't do that because of boundaries and such. But peer support, and again, if you don't like people, you're not going to magically like peer support specialists either, but it might be worth, if you'd be willing to take a risk on trying to connect with someone. You can find more information about them at our website, and there's actual phone numbers for individuals that you could link to. So you don't actually have to go to the crisis and support line if you don't want to. So I would urge you to take a risk, and my guess is that you would find it, I hope you would find it worthwhile.
Okay.
I'm going to add one more thing, if it's okay, Dylan, super quick. I'm actually just going to bring, because for some reason, I heard the question as a person calling in about somebody else, that they're worried about another person who doesn't like people. And I just wanted to kind of mention again what Gally brought up in her 4 points. Even if I'm worried about somebody who I know is not a people person, there's an amazing amount of power in me just saying, let's say it's Gally, in me just saying, Gally, I know you do not like it when people are sticking their nose in your business. I hear you loud and clear, and I still need to let you know, I'm going to ask if you're okay. So if you have a friend who does not like people, even the asking the question, the are you okay, at least I think for most of us in our experience, it still gets through. So I wouldn't be discouraged from asking the question, asking if you're okay, even if it is somebody who generally does not respond well to that. I mean, the worst thing that happens is they say, I don't want to tell you, but at least they know that you cared enough to ask.
Thank you for that, Commissioner Schrader.
Well, I'm not speaking as a mental health professional at all, because that isn't my bailiwick. However, on a personal level, I have found, if you can, this is an issue, if you can afford them and take care of them and love them, I have found having companionship with my pets, with a dog or a cat, also is somewhat helpful. If you're not really a people person, you can still come home every evening to these lovely creatures that love you no matter what. And that's not really, again, you have to have the resources and able to do that. But I have found them in times of loneliness or feeling disconnected or not having that I can always come home to the big black dog that's going to put his head in my lap, you know, and the little crazy dog that's just going to be a barking fiend, somewhat comforting. So I don't know if that's helpful, but as well as exercise, reading, eating, doing things that you enjoy every day. I have personally found pets to be very helpful in terms of emotional companionship and help. So just as someone who, it's not my field, but I have found it helpful personally. So
Thank you very much for that. Thanks to all of you. We have another question that has come in. It seems like this is more of a comment for commissioners. Hi there, I support, well, it's from a woman named Karina from the Milwaukee International Way Clinic. I support many staff members working very hard to meet the needs of our community members and their mental health and addiction needs. We are doing all we can to adapt to this new service delivery system, but it has been difficult to provide treatment at the same rate as we were able to in person. PPE, personal protective equipment, is needed for those that are meeting with our most at-risk community members who are unable to engage in telehealth, as well as staff and residents in our residential facilities. Commissioners, additional funding for our community mental health agencies will be helpful in ensuring our continued ability to provide these much needed services. We know the community need will not be decreasing as this pandemic continues, and these services are vital, and we want to be able to meet this need as we adapt to telehealth service delivery. Thank you for your partnership and support.
I'll go ahead and start with that. Very, very well said, Karina. Thank you for highlighting. Oregon is one of the least supported states in the nation when it comes to substance abuse treatment and mental health services at the community level. So I hear you loud and clear. I can tell you that our commission has been very active in advocating at the state level and the federal level for additional resources. I can also tell you that it's incredibly challenging from the county perspective in that we have a $1.2 billion budget, and you think, wow, that is a significant amount of dollars, which it is, but only about 137 million. And I may have that number wrong because it changes, but it's around that. 137 million is from property tax, which is our general fund flexible dollars. And about half of that goes to the sheriff for public safety. So our discretionary dollars in Clackamas County are extremely limited, and most of the resources that we get that for mental and behavioral health come from the federal and state government, which is one of the reasons why our region worked really hard with a collaboration with the business community and with nonprofits, religious and philanthropists to put on the ballot, which is on the ballot this May, a homeless services measure, which it taxes people at high incomes and businesses with sales over $5 million to provide revenue for people homeless or at risk of homelessness so that they can get case management, addiction treatment, whatever job training, whatever services that they individually need for stability. Working hard to find additional resources, but we are limited. So hopefully that measure passes in May and we will have additional resources to help people in our community. But that's kind of where we're at.
Yes, go ahead, Commissioner Schrader. Oh, but you're muted. You're muted, Commissioner Schrader. Oh no. Oh no, Commissioner Schrader, you turned your video off. Oh, Commissioner Schrader, if you can hear us, your video is off instead of your sound, but your sound's not there too. Well, while Commissioner Schrader gets back to us, we'll go to her if she can get back, but we've had a couple more come in. Let me get it right in front of me. Okay, from Alex in Westland. I am the captain for the Westland Police Department. What resources are available to an individual and or their family after an aggressive but unsuccessful suicide attempt?
Okay.
Oh, yep.
So Commissioner, do you want to answer that last question first, and then I'll do this one?
Okay, I just want to mention that the entire commission at this point has been extremely diligent, every one of our colleagues, at lobbying, not only at the state level, but the federal level. Most of us are very involved in the National Association of Counties. So we are constantly getting information about best practices of how we manage these kinds of issues, and also continue to get those contacts at the federal level so we can continue to lobby for the appropriate amount of resources we need for really helping people that have substance abuse issues and need those wraparound services. So thank you.
Thank you, Commissioner Schrader. I'm going to just repeat the question that we just had, just for the sake of the audience. I am the chaplain for the Westland Police Department. What resources are available to an individual and/or their family after an aggressive but unsuccessful suicide attempt?
Yeah, thank you for asking that question, Alex. So certainly we've said it a lot, but the crisis and support line would be the place that I would start. Our staff are able to help folks navigate the system. With someone who has recently attempted suicide, a lot of times, one of the things that we recommend is for them to actually get services through our mental health center, through the urgent walk-in clinic. And like I said earlier, we're not having folks physically come in the building. We are working on a telehealth option, and we are always available by phone. So I would start there, really. Particularly, we would be wanting to assess for whether this individual has stabilized after having this suicide event or attempt, or if because if they have stabilized and they're feeling a lot better, we might have even other options for them. But I would say the crisis line is the place to start.
I would also add to that, Dylan, a couple other resources for both this individual and their family. I'm not sure about the status of it right now, but I know, and it may be offered virtually, but Folk Time, which is one of our peer support organizations that we work with in Clackamas County, they offer a suicide attempt support group called Suicide is the Language of Pain. It is open to individuals who have experienced suicide attempts or individuals who have suicidal ideation. Folk Time's number is 503-238-6428. Again, it's 503-238-6428. I would inquire about their suicide attempt support group. And again, that is a group that is active and running definitely when we are not sheltering in place, and it may be running virtually, but you'll have to check with them. The other resource is the National Alliance of Mental Illness and the local Clackamas chapter. They have a number of supports for families of individuals who have loved ones who have experienced mental health issues or suicide attempts, and they offer a lot of support to people who are their caregivers or their loved ones. And they have active support groups right now that are very much virtually going very strong. So thank you for reaching out about this person.
Okay, thank you very much. Thank you very much, both of you, for that. I think we have time for one last question, as I see we're 5 minutes away, but another question has come in, and that is from Jennifer. I want to say how much I appreciate the commissioners taking the time to bring mental health to the forefront in this difficult time. I also really deeply appreciate the information shared by Elise, Gally, and Jeffrey today. Thanks for all that you do. I manage a small counseling program at Clackamas Women's Services that serves survivors of domestic and sexual violence. I worry a lot about the experiences of those who are at home right now, where home is not a safe place to be. Survivors of abuse, adults and children who may not have access right now to some of the supports that may have brought them greater safety before this time, and for whom accessing telehealth from home may not be safe or private. Can you speak a little bit to how the efforts you're talking about today can help address the needs for adults and children currently in those situations? I'd also like to share that for anyone experiencing domestic or sexual violence, that Clackamas Women's Services has a 24-hour support line, and we have recently added confidential chat on our website that is at, I will bring up the website in a second. These are not mental health services, but can offer extremely valuable confidential support. So would anyone like to speak a little to that?
I definitely, Jennifer, thanks for your question and letting us know. And I don't have a direct answer to your question, unfortunately, because I feel like this is a pretty complicated question, especially around the issue around domestic violence. What I can tell folks who are listening, and Jennifer, you probably know this, is that based on the numbers that are coming in through our 911 system, domestic violence calls since COVID-19 has occurred are up by 16%, and our 911 calls related to suicide are up by 11%. So based on those numbers, what I was referring to in the very beginning of this presentation about reaching out and checking in with people is crucial. By checking in with people, you know, we can better understand, better assess how they're doing, and maybe get some help if it's appropriate. Related to child abuse, one of the things that I would like to encourage folks to do is, you know, many of us on this call are mandatory reporters, and many of you listening are mandatory reporters. But as we all know right now, with kids not in school, mandatory reporting is down, not just for kids, but also for other vulnerable populations like our older adults and folks with disabilities. And so one of the things that I would encourage people to do is, even if you're not a mandatory reporter, please, if you are out in the community, I'm thinking if you're out in the grocery store right now, which is where, if we are leaving the house, that's where most of us are going. If you see something that doesn't look right and is suspect of abuse or neglect, please call it in. Please call it in to the child abuse hotline or the abuse hotline for our older adults or vulnerable adult population. And again, it's not our job as people who don't work in those fields to determine if something is abuse or neglectful. It is the professional's job to do that. It's our job to be the eyes and the ears. And right now, since those mandatory reporters don't have access to kids and to older adults and vulnerable adults as they would normally, the rest of us are who those kids and vulnerable populations are counting on to keep them safe. So that doesn't speak to the domestic violence situation, but it does speak to child abuse. So please, if you see something, say something and call it in. Don't assume that things are okay. Just call it in if you think that something is suspect of abuse or neglect.
And I'm just going to add one last thing. I know we're finishing up, Dylan, but Jennifer, thank you so much for calling. And this whole sheltering in place, there are particular parts of our community for whom this is a dangerous change. And so I'm going to ask Dylan, I think we're already getting these, but I will ask him to go ahead and forward your email to me so that you and I can connect tomorrow and maybe see if there is something that we can do with the resources that we have. We can at least get a little bit more of a sense of what you and your colleagues think might be helpful, and see if there's anything we can do and try and connect up around that.
Thank you for that, Elise. Commissioner Schrader, you have your hand raised. Oh, you're muted.
I'm mute. I just want to make one comment that I just want to thank Clackamas Women's Services for all the work they do, and my colleagues, all of my colleagues, including Commissioner Fisher, who is very supportive of their efforts. We could not be dealing with this issue at all without their long-term commitment and help, okay, to our community. And I'd also like to give, and let's see, their support line is 503-654-2288. Toll free, it's 1-888-654-2288. And evidently there's a confidential chat support Monday through Friday, 9:30 a.m. to 4 p.m. at www.resourceconnect.com/CWS/chat. So you can really have the opportunity to connect, hopefully in a way that's safe, where you can maybe have some privacy to talk about if you're dealing with abuse issues. And I'd also like to give a shout out to the Children's Center that regularly is also the group that will assess and look at children who have been suspected of having sexual abuse and those kinds of things. Those are two of our premier nonprofits that have been working on this for a while, and I know that we're just grateful for their support.
Thank you very much for that. Thank you very to everyone for that. I know we're a few minutes over, but I always like to go ahead and give an opportunity for any closing comments and closing words to the north of 100 people who are still with us.
I'm going to throw out one last resource, which is our senior loneliness line. And if you have folks in your life who are 55 and older who may not want to call something that's called a crisis and support line, they can also call our senior loneliness line, which is also available 24/7. And it's not intended to be mental health. It's not intended to be crisis. It really is for people who are just struggling with social isolation and loneliness. And that number is 503-200-1633. Thank you so much.
Thank you. Commissioner Fisher, did you, I think you were going to say something.
Yeah, just in closing, a quote came to my mind and I'm blanking on who said it, but the quote is, "I am one, still I am one. I cannot do everything, but I can do something, and I will not refuse to do the something that I can do." And I say that because even though we are in a time of isolation, we are all in this together and we are all connected. And so as we connect with those that we interact with, whether that's through teleconferences like this, or through phone calls, or through family members or friends, just ask the question, see how people are doing, ask if they're okay. And we have the resources that are here to take things to the next step if people need more help, but please connect, and that's how we will get through this most very challenging time.
All right. Thank you all for joining us today. I really appreciate all of our guests being here. I'm going to go ahead and share the screen one last time to leave people, of course, with the crisis line number that we have. I'd like to thank again Commissioner Sonia Fisher, Commissioner Martha Schrader, Elise Thompson, the System Coordination Manager in Clackamas County for Behavioral Health, Gally Murray, our Suicide Prevention Coordinator, and Dr. Jeffrey Anderson, our Crisis Clinic Supervisor. Thank you all, and please do thank you for viewing today. Appreciate it. And please do not be afraid or do not be hesitant to contact us if you need help. Thank you very much.